our vision, their vision, everyone's vision, was to create a building to house a multi-specialty group that was world-class. And we've done that. On June 3rd, we get to start serving our patients, something we've dreamed about for 20 years.
It's not only a synergy of the individuals, it's really going to be patient-centered care. We talk about it a lot, but do we really deliver it? Well, this is a kind of building that'll deliver it, because everybody will be here for the patient, and whatever they need, they'll be able to get it here. So that's really the excitement we've had. We've been talking about it for a couple of decades, and tonight's an exciting night that we actually get to deliver.
Now the patient can get both inpatient and outpatient care literally right across the street, and doctors can go back and forth between their office as well as seeing patients on the inpatient side, and so it makes the workflow, the patient's care, so much more seamless and convenient and higher level of quality.
Now that we get to be in a subspecialty building where we move our entire women's health service line into one floor of this beautiful space, we still get the nice cohesive practice model, but now we're in a building with all the other service lines that can help take care of these women for their non-gynecologic needs.
We'll be able to do a lot more multidisciplinary care for a patient. Instead of seeing them in one office, sending them to another office to see surgeons, sending them to another office to have echoes or stress tests or other types of testing done, will all be integrated on one floor. So I think it will be a much better patient experience.
And I can't tell you how many times when I've referred patients to my respective colleagues, just the physical handoff, that even though they don't have an appointment necessarily with them for maybe a couple weeks, if I can physically introduce them and say, this is Dr. So-and-so, they're going to take great care of you, you're going to see them in a couple weeks, it makes a huge world of difference.
Well, I think it's really important, especially in women's health, to be able to provide a physical environment where women feel inspired and a place that fosters health. And to be in a new facility with lots of light and art and a very optimistic feel, I think is just going to be a good thing. So we're excited.
I think the other thing around this facility that is really interesting and unique, especially for healthcare buildings, is the LEED certification, which is an environmental certification. And we found out just today that we qualified for LEED Gold.
Years of planning and preparation really focused on creating a healing environment for our patients here. The artwork that we have on the walls, the colors, the furniture, everything really to facilitate that experience that our patients are going to have here with their physicians.
So I think from just the aesthetics, the architecture, and the environment that the hospital brings about, is a sense that you're not really in a medical facility. And I think that takes away a lot of the anxiety that these patients will have.
I worked with the team that did the design here, and they asked me what I needed. We did a lot of calculations, and they built the whole space around what our needs were for the evaluation center and lending library. So that was great.
This is a tremendous advancement in terms of how we're going to take care of patients. In the past, all of our doctors were in different places and different locations, and now we're all going to be together in one spot, and that's really critical to the multidisciplinary care that we're trying to give to our patients and optimizing their care. We have stroke, we have movement disorders, Parkinson's disease, memory disorders, neuromuscular disease, neurosurgery. Pretty much all the common specialties or subspecialties in neurology are covered in our department.
So I was in the old place for about 18-19 years in the original ALS clinic that was started by Forbes Norris and his wife Dee Norris. And I think that what is the difference between being in the old office and the new office is that in the old office it was a little dated. And in this new space, we have a lot of, new technology. We have brand new offices. We have brand new exam rooms that better fit our patients. So for comfort level for patients to have neuromuscular diseases and ALS, this is a good space for them to be in because it better fits their needs.
One of the things that really impressed me as I was walking around this building is that we have physicians and care teams here who are some of the preeminent leaders in their fields in the country. And they have been doing miraculous work, and it's so wonderful to see them in this environment that's really designed with them and their patients' needs in mind.
I'm just excited. You know, care starts with great physicians and great caregivers and a great team. So we have that. So this is just really enabling them, giving them the opportunity to have the things they need to do even better. So it's really exciting.